سلايد ظاهر؟ طيب
ما صاير ريكورد. ما صاير، المفروض يطلع.
يا دكتور هي
ايوه. طيب طلعي لي البوينتر بنتي.
استنى هذا متسكين
بوينتر وين؟
استنى
هاي أنا هذا
هسه بس خلينا نشوف السلايدات تتحركوا تمام.
جاي على البوينتر.
استنى عيوني أحلى بوينتر كمان.
جود ثانك يو. افتح الريكورد.
ريكورد فاتح.
راح نميت.
لا صوت ممتاز. الصوت طالع.
اوكي. اوكي. السلام عليكم ورحمة الله وبركاته. اوكي. Today we are going to continue our thinking, to continue our lecture regarding the metal poisoning, of course, in occupation area. And we already mentioned one of them, which is lead poisoning. And today we are going to continue the lecture about mercury. We started already with the mercury. And we discussed all these. Okay? All these have been discussed. We said this is the area in which the worker being exposed to. This is the permissible exposure limit. You have to know it very well. Okay. And already we were in this area. Okay. Workers that are being at risk of mercury poisoning, so many areas, but for example, as I told you, electric equipment, okay. And we have fluorescent light bubble. This is very dangerous. If it's ruptured, we will inhale the mercury. And as you remember, we said the mercury is a liquid but evaporated, easily evaporated. And also automotive part manufacture, chemical processing plant, it means factories, worker in medical, dental, and so many other areas, thermometer, barometer, and so on, and also we have dentist and assistant breathing in mercury vapor with the amalgam filling. So all those be at a risk of mercury exposure. Of course, there is so many, and I don't know whether I discussed to you this picture or not. I already mentioned too. Okay. As we said, mercury poisoning can be resolved as inhalation, definitely, which is most common, and injection, and also by through skin absorption. Following ingestion, it is poorly absorbed. It's very poorly absorbed, and most of it will be excreted with the urine or with the fecal material. While following the contact with the skin, we have the elemental mercury liquid and vapor can be absorbed through the skin and it acts later on. We will see how it acts. It acts as you are inhaling the mercury. Elemental mercury is transferred to the developed, so it will affect, or it is transplacental effect during pregnancy, particularly in early trimester, and we will see what will occur to the pregnant woman when she exposed to mercury. The inhalation route gives the highest absorption rate for the mercury. Vapor is well absorbed following inhalation, and you remember we said when there is a heat, then the inhalation will be faster and the absorption will be faster also. So when we inhale the mercury, it will affect the kidney and the brain. Both of them will be affected. It is very toxic to the nervous system or to the kidney also. Elemental mercury is excreted from the body very slowly. It takes about 40 to 60 days elimination half-life. So it stays in the body, that's why it will accumulate it day by day. Most of the elemental mercury that we inhale, it will be excreted with the respiration. A small amount will go to the fecal material and urine, and very small amount via skin with the sweat, with the saliva, and with the milk. But the majority with the expiration. Source of non-occupational exposure to mercury. Inorganic mercury include in a new dental filling, as we mentioned, dental filling, and the most important is through the eating of seafood. What are the health effects of mercury? Of course, we have two types. We have either short or long, as we mentioned just now, and it depends on the concentration of the mercury and also the temperature. As we mentioned, the higher the temperature, the more the concentration and more the effect will be. Short term, this is very rare. Previously, yes, but this harmful effect is very rare, but it occurs in short-term exposure. Exposure to, of course, as we mentioned just now, exposure to high concentration of the mercury in the air, it will lead to acute effect. And this harmful effect, of course, as we mentioned, the most effect of the mercury is on the nervous system and digestive system, respiratory system, and kidney. Of course, this, as I mentioned, this effect will be high when there is a heat or heat evaporated the heat. Regarding the long effect, of course, from its name, it means it takes a long time. Okay? And this is occurred mostly on inhalation and also, as just mentioned, through the skin. Through inhalation and mercury liquid and vapor absorbed through the skin in a small amount with the time, it will be accumulated and it will give an effect which will lead to the long effect. So the effect following absorption through the skin are expected to be as similar as we inhale the mercury. So the same. So the general indication for the exposure of mercury is by testing the urine. Urine test is an indicator for the mercury. They didn't use the concentration of the air, mercury concentration in the air as a measurement of exposure. No, they consider the level of mercury in the urine. So, mercury level in urine are often used as a general indication of how much exposure had been occurred. As a result, urine mercury level, rather than just now I mentioned you, urine mercury level, rather than airborne level in the environment, are provided as in some report which compared mercury exposure to specific health effect. So they used the mercury. We have mercury in urine. We have just now few minutes. We will discuss the level accordingly in the urine. The relation between the air concentration and the urine concentration, till now they didn't know how much this equal to how much this equal. The relationship between airborne mercury level and urine mercury level is complicated, and they didn't know how can they calculate it, because there is another things. Maybe I exposed to the mercury from other side, from dental operation, or in any other, or it's related to the individual characteristic. We said measurement of mercury exposure is done dependent upon the level of the mercury in the urine. So the measurement of mercury in the urine is done by microgram per gram of creatinine, depending on the creatinine. So microgram of mercury per gram of creatinine. This is the measurement unit. They found that air exposure of 0.025, very little, it will lead to the urine level of 37 microgram per gram creatinine. So عليكم أن تسوون الكالكوليشن later on. So dividing the exposure into mild, moderate, and high exposure, or normal, definitely, according to the level of the mercury in the urine. When the level is less than 3 microgram per gram creatinine, we know that there is no exposure. When the level is below 35, of course, microgram per gram creatinine, this reflects low exposure, low mercury. Please حفظوها. Okay? أنا أقولكم ليش. When the level between 35 and 50, this means moderate exposure. When the level 50 to less than 100 or 200 microgram, we call it high moderate. High moderate. When it is more than 100, it means high. يعني يمكن بالامتحان ما أجيب لكم الأرقام. Okay. So these are the level classification of mercury exposure according to the level of mercury in creatinine. So this is the same just now we mentioned. Again, I will repeat it to you. Less than 3, normal, me and you, or any other occupation. With less than 35, it is mild or low exposure. 35 to 50, it is moderate. 50 to 100, moderate high. More than 100, it means high exposure. Okay? And this measurement is milligram per gram creatinine. Now, what's the health effect? Of course, initial exposure to high concentration, as we mentioned, will cause acute. And this if it is high concentration, the person will get what we call it metal foam fever. There is fatigue, fever, illness, headache. Okay, muscle, joint, and pain, and lack of appetite. This is then addition metallic, and then he or she will feel some metallic taste in his or her mouth. This is another sign for the acute. Respiratory system effect include, of course, cough, shortness of breath, tightness and burning pain sensation in the chest, and inflammation of the lung. Now, occupation exposed to 1 to 44 milligram per meter cubic in the air, mercury vapor for 4 to 8 hours cause chest pain, cough, and blood with the cough. No, this is exposure to 1 to 44, but in the air, not the level, not in the urine. Then impaired lung function occur and inflammation of the lung. Then pulmonary edema may occur, and then fatality will occur or death will occur. This is too high. To the light exposure, as I mentioned, it will take time. But unspecified concentration to the vapor, this causes death. This causes death if it is high and unspecified concentration, so it will cause death right away. All reported deaths resulted from inhaling mercury vapor from heating. Just now, several times we mentioned that heating the mercury is a dangerous thing. Now we said the mercury affects nervous system, kidney, respiratory, and so on and so on. Now coming to the nervous system, it will cause muscle coordination, mood and behavior changes, disturbance in the mood and behavior, change in the memory, and feeling, change in the feeling and nerve conduction. These effects being observed with the employee with the moderately high exposure. So, أنا خليت لكم question, you should know the level. Moderately high or high level. It means 50, 100 and more than 100 and or high. فوق 50 and 100 and more. So please. فهمتوا قصدي؟ Okay. Now, tremor, of course, affecting the hand, first of all, and then spread all over the body. Emotional instability, just now we mentioned, okay, including irritable, excessive shyness, and loss of confidence and nervousness. Sleepless disturbance, memory loss, we mentioned muscle weakness, headache, slow reflex, and loss of feeling or numbness in the hand and leg. This is effect on the nervous system. Damage on the nervous system, and it will affect the hand and leg, the arm and leg. We call it polyneuropathy occurs with the high concentration. It means above 100. Okay, when we have polyneuropathy, it means this person had been exposed to more than 100 in the creatinine, in the urine, level of creatinine. Reduced sensation and strength in the arm and legs, muscle cramp, and decreased nerve conduction had been observed also. Employees with the episode, in this episode of a very high exposure will have these symptoms. The pathogenesis of the mercury on the nervous system, on the neurotoxicity, it will selectively accumulated in hippocampus, basal ganglia. That's why it will affect to the feeling. Okay, it will affect it will inhibit the release of serotonin, and also it will inhibit transferring of the serotonin. That's why he will be depressed, he will have some psychological effect. Just now we mentioned he will shy and so on. So prevent serotonin release and inhibit serotonin transport, causing calcium disruption, causing demyelinated neuropathy on the nervous system, causing abnormal neural cytoarchitectures, and all these will affect the nervous system. This is regarding the nervous system. Other effect of the mercury, as we mentioned, is on the kidney. So many disease will affect from the simple to the death. Okay? To the death, it will affect ranging from increased protein in urine to the kidney failure. So it's effect also. Exposure to high concentration of mercury has also caused increased blood pressure and heart failure. Of course, affected the kidney, blood pressure will affect it, then heart, okay, heart rate and heart failure. When there is an effect, we say the other effect is that one, inhalation. Now coming to the effect through the skin, we said it is similar to the inhalation almost, okay? Although it's occurring very rare, but it will give us a similar picture. Elemental mercury is not known to directly irritate. It does not irritate the skin, and an allergic condition will react, okay, and then it may absorb to the body and causing systemic effect. Elemental mercury liquid and vapor can be absorbed through the skin and may contribute to the overall absorption and toxicity, as we mentioned just a few minutes, as that of the inhalation. We said it affects pregnant. Actually, yes, affect pregnant women, but it's more affect the babies. So it transplacental occur or maternal transmission. Okay, it may cause spontaneous abortion. We say particularly during the first or early pregnancy, cause abortion, cause stillbirth, during my stillbirth, baby born dead, and it may cause congenital anomalies, spinal bifida, and so many other congenital anomalies. This is via among pregnant women. So what's the diagnosis, of course, of mercury poisoning? We have physical examination, blood and urine. This is general. Physical examination, we already mentioned. Blood mercury is only useful within 3 days. Because we see absorption is very low and excretion is. So it's only within first 3 days, otherwise the blood exam or blood test will not helpful. 24-hour urine specimen is good indicator for inorganic mercury. Somebody said that measuring the mercury in the hair, but this is not useful. As mentioned by WHO, hair mercury level is no wrong. This is according to the WHO. For treatment, of course, there is no cure, there is no treatment to cure the mercury poisoning. Once neurological effect being occurred, it will be permanent. It will be permanent. There is no restore of the sign and symptom. Of course, as any other exposure, the best way is to stop exposure, definitely. And then, if you remember from the last lecture, we said we will do chelating of the substance. You remember? So, if toxicity is linked to the workplace, we have to remove it. But if it's related to the eating of seafood, so we have to stop it. And then chelating agent or chelating process should be done for this. In inhalation mercury, of course, there is chelating. It will be no use by giving saline, okay, emesis. Oral steroid is a common practice, but they don't know whether it will affect or not. Most of the inhalational form are self-limited. In mercury, if mercury level reach point to start chelating, just we mentioned, we have to do chelating, and you know what to do. Hemodialysis is used in severe case of toxicity because it affects the kidney. Control hazard condition. Mercury is very, very toxic substances, we mentioned it, and it is also corrosive. It is used in amalgam, as we mentioned, and many other areas, and jewelry, golden jewelry. Controlling mercury exposure is best accomplished through substitution. Can use another material that is less toxic than it, or non-toxic. Engineering, as any other occupational disease, administrative, you remember those things, and of course, personal protection, PPT, you know it. Engineering method, so many things. راح امشي عليه سريعة لأنه أنتوا already you know it وامتحنتوا بيها وكلكم جبتوا علامات كويسة. Okay, mechanical ventilation. Okay, نسوي dilution اللي هي يلا نسوي ventilation outside. Process of personal enclosure, we already mentioned in so many areas. Okay. Then control measures we have to follow. Isolation of the area. You remember we said isolation, segregation, or enclosed. Separated or aside from other areas, separated exhaust ventilation. ما أخليها مع البقية. نفس الشيء. No need. cleaning of contaminated exhaust air before it will go outside. Personal protection, definitely PPE. Approved respiratory protection, I should give it to them, should be available to the worker. Complete respiratory protection program included selection, fit testing, and everything should be, we have to be sure about these things. Face shield should be used اللي لسه شايفين من الكورونا. All these will be chemical protection, full body من فوق لتحت protected because should be used. Remove contaminated cloth immediately and put in a closed container. سكر. طيب Mercury. Discard or launder before re-wearing. Discard much better. لا حاليا كل disposable. Don't eat or drink or smoke in the area when there is mercury. Maintain good housekeeping. Wash hands thoroughly after handling this material. Before handling, it is important that engineering control قبل ما أبدي أجيب هذا المادة بالفاكتوري I should be sure that the engineering process is complete and it is fit. Okay, you remember we see the first line is the engineering. So engineering should be operating PPE, okay, personnel should be available, and not only that, the worker should be trained how to use it, how to protect themselves, how to keep the contaminated one. Unprotected person definitely should be avoided to be in this area. Use a type of container. Actually, here, this is the difference from the other. We have to use a container to put the used material, and then this container should be put in another container. So the container should be used in order to prevent leaking of the mercury. So use a type of container recommended by manufacturer. Inspect container for leak before using. Immediately report if there is a leak. Never return contaminated material to the original, and secondary protective container should be used. So two containers should be used. Avoid damage label container. It should be labeled. You should assume that any empty container is contaminated. ولو قطرة صغيرة. So you should not touch it and you should put it in a. Avoid, okay, generating vapor or mist. Don't heat mercury in other than closed system. Of course, the other things, good housekeeping, don't use curious work surface. ما أحط المركري على السيرفس اللي يكون خشنة لين دقة. Okay, so you like a wood, use work surfaces which can easily be contaminated. So all these, something is new, and all these are, today we finished, not only finished, أي سؤال, but you finished year 3, inshallah, you will go to the أي سؤال؟ ما سؤال. Okay. Thank you very much. وأتمنى لكم النجاح. كيف كان علاماتكم كويسة؟ إن شاء الله تكون أحسن.